According to the university website, there are 5 mental wellness counselors and 4 staff members working at the Student Counseling Center at USM. There's an estimated 1,100 students that see SES counselors yearly. If you do the math, that's around 220 students per counselor. Heidi Nelson, the director of Student Counseling Services, declined an on-camera interview mainly due to staffing issues within SES. She declined to answer if she felt the university provided enough resources for her office. In an email reply, Nelson said, quote, "Our scope of service is on par with most college campuses where we deliver both individual and group therapies along with crisis intervention and referrals. Though having more than 5 wellness counselors on SES staff is desirable for assistant directors like Amanda Kirtland."
I think it'd be great to have more. I think that, the more staff we have, the more we would have a chance to serve more students. I think that we have been able to do a lot with who we do have on staff, but certainly I think it'd be beneficial to have more staff.
In any case, workloads like these are stressful for many, like former SES counselor Casey Johnson.
I think a lot of clinicians would say that, that it does get stressful and overwhelming managing things like on-call and higher incidents of safety concerns on their caseload.
William Clark is a senior psychology major. He started as an engineering major, but changed his career path to psychology as the need for more mental health professionals became apparent during the pandemic. He sees the need for more resources within SES.
I'd say overall it has been good, but it could be better. I think that obviously we could use more staff members.
But according to SES officials like Amanda Kirtland, counseling services are already operating efficiently. According to SES officials, there is no waitlist.
I've been with the center for just shy of 7 years, and I don't think we've been on a wait list since 2017.
At first I was kind of discouraged because I heard they had a wait list and that the wait list could take months at a time.
The expectation of delays in mental health services is a barrier for many students. For those like Asa and Pika, hearsay caused them to not seek services until this semester. They received correspondence from SES within 1 week of requesting counseling.
And then this semester, I actually reached out and I realized it wasn't as difficult as they made it seem.
John Benet Kepper is pursuing her second bachelor's in an accelerated nursing program. She used SES during her first stint as an undergrad. Kepper believes that more visibility and promotion could help students know about resources on campus.
Being out in the community more would be a thing that would help more students feel more comfortable seeking help and learning more information about what resources they have to offer.
Kepper remarks how much counseling has equipped her to manage her mental health.
Even if I hit a moment where I'm in a low again, I know how to better help myself, and I don't feel as negatively towards going to counseling and feeling bad about it.
Even in Johnson's private practice, he makes a concerted effort to direct students to free resources.
I make it a point to refer those people back to campus because, one of the biggest stressors for students is finances, and if they can access free counseling services, that's a big deal.
Students can reach out to SES in 3 ways. They can call them, they can email them, or they can complete a form online. Other resources on campus have also filled in the gap at USM. The Center for Behavioral Health and the Center for Family Therapy are similar counseling services available to the USM community. Heaven Brown, USM reports.